The passenger from South Sudan died soon after arrival in Nairobi. Test results came back negative for both Ebola and Marburg hemorrhagic fevers. But her arrival at the Jomo Kenyatta International Airport was a scare enough to question the country's preparedness in dealing with the virus that continues to kill many in some West African nations. The Ministry of Health now laying the blame squarely on one airline, FLY540.
Whereas the Port Health did pick up this case, we agreed there was a bit of a lapse, but not on the part of Port Health, because we should have been alerted by the airline before they actually flew and in flight as well, to indicate to us the condition of the patient, so that the authorities on the ground will be ready to handle the case when it comes here.
But the airline, through its Director of Affairs and Compliance, Nixon Oyo, has distanced itself from any wrongdoing, saying the crew on board followed due process in handling the matter.
A decision was made that without a doctor's certification of fitness to fly, she would not be boarded on that flight. And the reason why we insisted on a doctor's note, because we are not doctors, is, first of all, is to lay fears that we are not dealing with a contagious disease. And in this case, we are not dealing with either Marburg or Ebola. Yes, and that is why we would like a professional actually to put it down and not ourselves.
The airline says it did not see any need to alert ground staff of the sick passenger on board.
Devoid of any emergency, there was absolutely no need whatsoever to call tower and tell them that I have an emergency, because that emergency was not destined for Jomo Kenyatta.
But the situation would change when the passenger landed at the airport.
What she had said in Juba is she was having heavy monthly bleeding. When the nursing sister was talking to her, she then told her that she had actually had, when she was in Juba, she was bleeding from the nose and the mouth and also having heavy periods.
The airline insists that despite the ongoing measures to keep the Ebola virus out of the country, there are clear loopholes, since the airlines cannot single out sick passengers unless they are completely honest in the information they divulge.
If passengers conceal their condition, the airline would not know about it.
The Ministry of Health, however, says that there was a clear breach of civil aviation regulations, and according to the Health Secretary James Macharia, the ministry is liaising with the Kenya Airports Authority to determine which sanctions will follow, if any. Esther Kahumbi, Monday Special.